Hi guys, this is Alan Gardner and welcome to this short video on preparing for your endpoint assessment for your apprenticeship and master's degree in advanced clinical practice. So the endpoint assessment, or EPA, is set nationally and constitutes a group of assessments that make up the final 20 credits of your master's degree, and once you have passed the EPA, allows us to award you with your apprenticeship. Prior to sitting the final assessments, you need to go through Gateway, which is a formal point for all apprentices, and it's the point at which we recognise that you're ready to sit the endpoint assessment. So the Gateway criteria that you're expected to meet include ensuring that you're still registered with your statutory body, achievement of the English and mathematics qualifications at a minimum of level 2, 160 credits, so the rest of your master's degree. We ensure that you've completed all necessary modules, and there needs to be confirmation from both your employer and UCLAN as the higher education institution that you have met the apprenticeship standard. This final piece being judged against the knowledge, skills and behaviours which have been integrated throughout your work on the apprenticeship. Once you have successfully been through Gateway, you are then able to sit the assessments for the EPA. However, prior to Gateway, there is some preparatory time, as this makes up the final 20 credits of your master's degree, and you will be supported by the academic team as you work towards successfully completing the endpoint assessment. We currently offer several online sessions where you will work as part of a group and independently to prepare for the EPA, utilising certain formative milestones such as completion of your case studies, ready to sit a mock exam ahead of the summative EPA open book examination. We also provide other opportunities for formative assessment and plenty of time to discuss your ideas in an open forum that's supported by academic staff. But now let's look at the EPA assessments themselves. These have been designed to offer a culmination of all the work that you've been doing in the run-up to the EPA, so the work that you've completed throughout your apprenticeship prepares you for the EPA itself. The assessments are made up of an open book examination, which lasts for 2 hours and 20 minutes, during which you will be asked questions relating to the clinical pillar. For example, you may be asked to explore your clinical decision making and how you've reached a safe and accurate working diagnosis. These questions will have to be structured around case studies that you will prepare yourselves based on patients that you have seen. A significant part of the preparatory time in the run-up to EPA will be spent ensuring you understand what is needed for your case studies and helping you to be able to ensure that these will perform well for you in the examination. The second component of the EPA is the presentation of practice. This piece of work is subdivided into a 1,500-word clinical practice change report and a 35-minute presentation. With this piece of work, you will propose a new quality improvement project, the aim of which is for you to continue working in the remit of quality improvement post-qualification. In compliance with the apprenticeship standard, all assessments as part of the EPA are marked by our independent assessors. If you're interested in ensuring that you make the most of your time on the apprenticeship, preparing towards the endpoint assessment from the start of the course, then head on over to the next video in this series where I'll talk about all the opportunities in the programme for you to work towards endpoint assessment. I've been Alan Gardner and thank you for listening.